My name is Mini Sethi. Today I will discuss about cognitive behavioral therapy. In short, we can say that CBT. What does CBT mean? CBT basically a treatment that identify and change our disturbing thought. CBT basically a treatment that identify and change our disturbing thought, because our disturbing thought have negative impact on our feeling and behavior. Our disturbing thought have a negative impact on our feeling and behavior. CBT identify our disturbing thought and change our disturbing thought. That is basic task of CBT. Okay, our thought, feeling and behavior are interrelated. This is basically a cycle. As we understand, our thought, feeling and behavior are interrelated. As we think, accordingly I feel, accordingly I behave. I will give you an example. Suppose I am thinking very bad. I'm thinking very bad, like nobody loves me. He did wrong with me. She did wrong with me. All day I am thinking very bad. Because I am thinking very bad, accordingly I feel. Because in my mind there are so many negative thinking are running. All day I am thinking, he did wrong with me, she did wrong with me, nobody loves me, nobody cares for me. I am thinking very negative. Accordingly I am feeling. I have negative emotion of frustration. All day I feel very frustrated because I am thinking very negative. My thinking influence my feeling. As a result, I feel very bad. I feel very frustrated. Accordingly, I will behave. I don't want to talk anybody else because I am feeling very low. Okay, I don't want to talk anybody else. I don't want to receive the call of anybody else. I want to reply the message of anybody else because I am feeling very frustrated. Okay, means I am thinking negative. Accordingly, I feeling negative. Accordingly, I behaving negative. Our thinking, feeling, and behavior are interrelated. On the other hand, if I am thinking good, I am feeling good, I am behaving good, because all tasks are interrelated. CPT basically work with our thinking. CPT basically work with our thinking. CPT identify our negative, disturbing, unrealistic thought and replace it with realistic thought, constructive thought, so that our feeling can be changed. According to it, our behavior can be changed. Okay, this is basically task of CBT: identify a disturbing or unrealistic thought, so that our feeling can be changed and accordingly our behavior can be changed. That is main task of CBT. CBT works with our thinking process. Okay, we will understand CBT with the example of panic attack. Panic attack. Okay, what does panic attack means? Panic attack means a person have an intense feeling of fear. A person have an intense feeling of fear without any actual dangers. Person are in intense fear when he or she has a panic attack. Okay, what are basically cause of panic attack? We will understand with these cycles. Okay, first of all, I am talking about triggers. Okay, trigger, situation. Okay, suppose we are giving example of person A. We are giving example of person A. Okay, person A when have a minor chest pain. Minor chest pain, these are triggers. When person A have a minor chest pain or minor heaviness in a chest, he think like that he's going to have a heart attack. When person A have a minor heaviness in chest or minor chest pain, he think like that he is going to die. He is going to die. Okay, he is having a heart attack. He is having a heart attack. Person A is thinking like that. This is person A disturbing thinking. This is person A unrealistic thinking, because he have heaviness in chest or minor pain in chest. He think like that he is going to die. He is going to have a heart attack, because in heart attack person have a chest pain. He is thinking like that. If he continue thinking negative, as a result, he is feeling very bad. Okay, as a result, he's feeling very bad. He create intense emotion of fear. He create emotion of fear. He have intense fear of dying. Intense fear of dying because he's thinking very negative. He's going to have a heart attack. He's going to have a heart attack. As a result, he start feeling very bad. He create negative emotion of fear. He have an intense fear of dying. He starts sweating. He have a sweating. His heart is racing. Okay? His heart is racing. His heart is racing. He have lot of sweating. As a result, his chest pain is exaggerating because of anxiety. Because he has too much anxiety. As a result, his chest pain is exaggerate. Okay, he is feeling negative. He's first of all, this is a trigger. He has a minor chest pain, minor heaviness in pain in chest. He's thinking like that. He's going to die. He's going to have a heart attack. And because he's thinking so much negative, as a result, he feel very bad. He create a fear. He create negative emotion of fear. He have an intense fear of dying. He has a sweating. A lot of sweating. His heart is racing. His chest pain is exaggerating. These type of feeling. These type of negative feeling he has because of negative thought. ठीक है? As a result, he visited to lot of doctors. Doctors made so many tests. Doctor did so many checkup of him. His all reports are fine. His all reports are fine. After getting his fine report, he gets some relief. Keep in mind, he get only some relief after seeing his all reports are fine. But still, he has lot of doubts in his mind. Maybe something is missed by doctor. So maybe something is skipped in his test report. He still have a problem. He still may have a heart attack. Still, he has so many negative thoughts. Instead of all reports are fine, he gets some relief after making appointment to doctor. But still, he has so many doubts in his mind. As a result, he avoid because of negative feeling, his behavior will be impact. Avoid all stressful situation. He avoid all stressful situation, all an anxiety situation. Okay, he will not face any stressful and anxiety situation. Okay, we can see he's thinking negative because he has minor chest pain. As a result, he's thinking negative. He is going to have a heart attack. As a result, he's feeling negative. As a result, he's behaving negative. Now, what does CBT do? Now we are performing CBT on person A. What does CBT exactly do? CBT, first of all, correct his negative thought. Suppose this person go to therapist for his treatment, and therapist performs CBT. In CBT, therapist first of all check his negative thought. Okay, why person create negative thought? Person create negative thought because he has a minor chest pain. The therapist try to make him understand. Therapist try to change his unrealistic and disturbing thought. His main disturbing thought is that he is going to have a heart attack. Person A, main disturbing thought is like that he is going to have a heart attack. Therapist, because CBT work on your thinking process, therapist try to change his disturbing, unrealistic thinking. ठीक है? Therapist try to make him understand that this is only an anxiety. This is not a heart attack. This is only panic attack. In panic attack, you have intense fear of dying. But in panic attack, you are not going to die because in panic attack, your blood pressure is high, and most of people die when their blood pressure suddenly drops. So you are opposite to pass out. You are opposite to die. In panic attack, keep in your mind you are not going to die. Okay, you have only fear. This is your anxiety. This is only your stress that can be cause of pain in your chest. Okay, this is not heart attack. First of all, you must be understand. Second most important thing, there are so many cause of chest pain. Yes, there are so many cause of chest pain. In past, you have so many time of chest pain, but you didn't have a heart attack. No? Same you have chest pain. Same you have minor chest heaviness. This is only an anxiety. You need to work on your anxiety. You need to reduce your stress. You need to do some breathing exercise. You need to do some affirmation. Okay, that can reduce your anxiety because that is only an anxiety. Therapists make so many statements like that so that his disturbing thinking can change. If therapist give so many statements like this in second, third session, he will get some relief. Slowly, his disturbing thought replace in constructive thought. Replace in constructive thought. Constructive thought like that in panic attack, I am not going to die, this is only my stress, this is only my anxiety. Okay, it is slowly his a disturbing thought convert into constructive thought. Once their thought become realistic, once their thought become constructive, his feelings start improve because he thinking good, he thinking realistic, he thinking constructive. Accordingly, his feeling will change, and accordingly, his behavior will change. Okay, that CBT exactly do. CBT work with our thoughts. Okay, I think you can understand. Thank you.